Dr. Tara Dall is back with us now, and you're talking about something, MTHFR?
MTHFR.
I got it right. Okay.
Yes, you did.
What in the world does that stand for, and why is it important?
Okay, so this is actually a gene. It affects the way our body metabolizes folic acid, and other things. It's really critical. It's something that if you have a mutation in your MTHFR gene, it impacts your ability to metabolize folate.
Which is a big deal for women of childbearing age,
absolutely.
right? Because that's the only time my doctor ever told me to take folic acid, was when I was pregnant.
And so what we do is we tell women to take folic acid to prevent neural tube defects, and it's been shown to be of benefit. The thing is, if you happen to be somebody who carries a mutation in this MTHFR gene, regular folic acid won't actually do anything for you. It won't be a benefit. And women don't know this. And I don't even think OBGYNs are typically screening for this. So if you happen to be somebody that has a mutation in MTHFR, what you need to take is what's called L-methylfolate instead of regular folic acid in order to get the benefits of the folate that you're taking. So that's really important.
Could you just take that type anyway?
You really could. And I think if you're not getting tested, it's probably better and safer for people just to take the methylated version of folate, or what's called L-methylfolate. And you can get that over the counter. You don't need to get it as a prescription. Because then if you have the mutation or you don't, you're at least going to be getting the benefit from it. But most people don't.
Here's my frustration, Dr. Dall, honestly, about healthcare in general, is that if doctors know that there's a mutated gene that prevents you from using folic acid the proper way, why are they still prescribing it, or why aren't they asking people to get that test? And if you don't get the test, why not just tell them to take the other form of folic acid?
Right. I wish I had the answer
for
you. I'm not so sure though all doctors are aware. I'm not so sure that's the case.
And that's a whole other issue.
Well, and I mean with MTHFR, I mean there's actually increased risk for miscarriage if you're taking, if you have it and you're not aware of it and you're not addressing it. I mean it has significant impacts for women. Some people who have an MTHFR mutation actually will have treatment-resistant depression. And they're taking all these antidepressant medications, and when all they really need is a little bit of L-methylfolate, and it kind of helps them metabolize all the other medications properly.
Okay, and that's what I was going to ask you. So aside from being, so important if you're pregnant or having a baby, so depression, anything else that it affects?
Right. I mean, it affects a lot of different pathways that impact the way our bodies metabolize medication. Usually when people have a mutation with MTHFR, I recommend that they take a methylated form of B12 as well as a methylated form of folate, L-methylfolate, and then it's amazing. Some people really feel dramatically better. I mean, I've had patients
because it's like they've been taking nothing.
Yeah, and they didn't realize all of the pathways that it really can impact. There's probably a lot that we're not even yet aware of. But I don't know that many doctors are doing this routinely, and in the OBGYN population, I mean, it's just, I think it's a must. I mean, just because of the fact it increases your risk for blood clotting, increases risk for miscarriage and other things. And that's something that women, when they're taking hormones, that can increase risk for clotting. And we should really be aware of any other genetic risk that we have so that we can make good choices about what we want to take and what we don't want to take.
No, people get concerned when we talk about, additional testing over and above what your doctor might recommend. But you all work real closely with insurance companies, and you work with your patients. You make it real easy for them to come in and have something done. Right. Work it through insurance.
At all. So very affordable testing.
It is, and it is a must. As I say, every week when you're here, it's just, we learn something new, and it gets me, I need to make the appointment and come back in and get more testing done, I think.